Good afternoon. I will start with the usual update on some of the key statistics in relation to COVID-19. As at 9 o'clock this morning, there have been 15,682 positive cases confirmed through our NHS labs. That's an increase of 17 from yesterday. A total of 909 patients are in hospital with confirmed or suspected COVID-19. That represents a total decrease of 78 since yesterday, including a decrease of 10 in the number of confirmed cases. A total of 21 people last night were in intensive care with confirmed or suspected COVID-19. That is an increase of 3 since yesterday, but all of the increase, I should say, is in suspected cases. I'm also able to confirm today that since the 5th of March, a total of 3,858 patients who had tested positive and needed hospital treatment for the virus have been able to leave hospital, and I wish all of them well. And in the past 24 hours, 5 deaths were registered of patients confirmed through a test as having the virus. The total number of deaths in Scotland under that measurement is now therefore 2,439. As always, it's important to stress that the figures I've just read out are not just statistics. They all represent individuals who right now are being mourned by their families and friends. So again, I want to send my deepest condolences to everyone who has lost a loved one to this illness. I also want to express my thanks, as always, to our health and care workers for the extraordinary work that they continue to do in very difficult and testing circumstances. Now, I want to highlight 3 issues today. Firstly, I will cover our latest report, which has just been published on the R number. I will update on some developments in the construction industry and talk about support that we're making available for students over the summer. I'll then close by reflecting on the importance of our Test and Protect system, which was launched 2 weeks ago, and our wider public health guidance. Let me start, though, with today's report on the R number. As you will recall, the R number shows the rate at which this virus is reproducing. So, in summary, if R is above 1, every person with the virus will infect more than one other person, and the virus will then spread exponentially. If R, though, is below 1, the number of people with the virus will fall. We estimate that the R number in Scotland as of last Friday, the 5th of June, was between 0.6 and 0.8. That is a lower estimate than for 2 weeks ago, when we calculated that the number was likely to be between 0.7 and 0.9. So under that estimate, we expect that the virus will continue to decline. In addition, we estimate that last Friday, 4,500 people in Scotland had the virus and were infectious. Our previous estimate for the 29th of May had been that 11,500 people were likely to be infectious. Now, that, of course, sounds like a very big decline, so it's worth me stressing that we don't actually think the number of infectious people has more than halved in just 1 week. What has been happening is that we have been reassessing our estimates for previous weeks based on the latest figures available to us. So in short, it's likely that the 11,500 was an overestimate, not that the number has halved in a single week. However, notwithstanding that, these latest estimates reflect the encouraging data that we have seen in the last couple of weeks. And there is no doubt, looking at all of this data, that we are making very real progress in combating and suppressing the virus in Scotland. However, as always, it's important that I inject a note of caution. Firstly, the estimates that I have reported to you today, of course, don't yet take account of the phase 1 changes that we made to begin the easing out of lockdown, and we need to continue to monitor any impact from that carefully. And secondly, the number of people who we estimate will be infectious is certainly smaller than it was, but it is also still large enough to make the virus take off rapidly again if the R number was to go much above 1. So for these reasons, we need to celebrate the progress, but continue to be careful and cautious. Next week, in fact, a week today, we will have a further review of the lockdown restrictions. I am currently very hopeful that at that point we will be able to lift some further restrictions. We may not be able to do everything in phase 2, but I hope that we can do certainly at least some of that. Of course, it is also possible that some of these changes will be phased over a 3-week period, but I'm hopeful that we will be able to take some further important steps forward when we report on the review next week. But it is important, again, to stress that we must do that cautiously and proportionately. I will also make the point I frequently make, but it is not just an obvious point, it's a very important point. We will be in a better position to lift more restrictions if all of us continue to stick with the current guidelines and further suppress the virus to lower levels than it is even now. Now, one area where we judge we can make some further progress now is in the construction industry. I can confirm today that the sector will be able to move to the next step of its restart plan, which is something that was always envisaged as part of phase 1 of our route map. So it's not a change to phase 1. Earlier steps have allowed for health and safety planning, followed by preparatory work at construction sites, and moving to the next step of the industry plan will now allow workers to return to construction sites gradually while using measures such as physical distancing and hand hygiene to ensure that they can do so safely. I'm very grateful to the sector and to trade unions for the very responsible approach that they have taken during an incredibly difficult time. It's important to be very clear, though, that we still have a long way to go before construction will be working at full capacity. But there's no doubt this is a significant step in allowing an important industry to return safely to work. I can also confirm today that we are extending our Help to Buy scheme, which was due to come to an end next March. We're extending that to March 2022. Under that scheme, the government provides up to 15% of the cost of buying a new build home and recovers its share of the funding when the property is sold or when the share is bought out. In recent years, this scheme has helped 17,000 people, more than 3/4 of them aged 35 or under, to buy new build homes. It has also, of course, been a valuable support for house builders. At present, of course, the pandemic means that the scheme is not being used, so by confirming that it is being extended, I hope we can ensure that more people who may otherwise have missed out on this scheme are able to move into new homes in the future, and also that we are able to provide a bit more confidence for the construction sector. The third issue I want to talk about is support for students. We know that many students rely on income from seasonal or part-time jobs, especially over the summer months, and that the economic impact of COVID will therefore cause them particular difficulties. And that can be especially important for higher education students who, unlike further education students, can't usually claim benefits over the summer. We've already provided additional support for students, and we've also suspended debt recovery action by the Students' Awards Agency. And today we're bringing forward more than £11 million of further support. This funding will be administered by colleges and universities to help higher education students who most need it. And it's a further way in which we're trying to support students at a time when we know many of them are still facing potential hardship. Now, the final issue I want to cover today relates to my earlier discussion of the R number and how we hope next week to announce some further changes to lockdown restrictions. As we do that, as we gradually, and I emphasise gradually, return to meeting more people and living a bit more freely, which all of us are, of course, keen to do, our test and protect system will become ever more important in helping us all to live a less restricted life while still being able to suppress the virus. Now, yesterday we published the first data from the system, which started 2 weeks ago today, and that data shows that in the period up to the 7th of June, 681 people who reported symptoms had tested positive for COVID. As of yesterday, contact tracing had been completed for 481 of those and was in progress for a further 50. Amongst those 531 cases, a total of 741 contacts had been traced. That's just under 1.5 people per case. And of course, people's contacts right now will be lower than normal because of the lockdown restrictions that are in place. Now, there's 2 points that I think it's important for me to note about this data. It is very initial data. The first is that the number of people who've tested positive is higher than is suggested by our daily figures, the ones I report on new cases here each day. That's because our daily figures don't yet cover tests from labs run by the UK government, such as those for regional test centres and mobile units, although we will be able to include that information very soon. In addition, the current figures slightly overstate the number of cases where no tracing has been carried out so far. One reason for that is that some historic cases from the time when the system was being piloted still feature in the data. And if that historic data is removed, the proportion of completed cases increases from 71% to 86%. We will publish more detailed data on Test and Protect in the weeks ahead, because it's important not just that government understands how well it is working, but you, the public, can see that too. But I want to be very clear that our preliminary indications are that Test and Protect is already working well. And of course, we will identify areas for improvement as and when they arise and as the system becomes ever more established. Fundamentally, though, I want to stress to everyone watching just how important Test and Protect is and how important it is going to continue to be in the weeks and potentially the months that lie ahead. I guess it essentially represents for all of us a kind of social bargain. If you have symptoms, and in some ways actually this is the much more difficult bit, if you have been in contact with someone who has symptoms, even if you don't have symptoms yourself, we will ask you to isolate completely. We'll support you in doing that if you need that support, but it is still a very tough thing to ask people to do. However, and this is the social bargain bit, if all of us agree to do that when necessary, it means that all of us together, collectively, will be able to continue to emerge from lockdown while keeping the virus under control. At any one time, some of us will have to self-isolate for a period so that together, all of us can start to lead a less restricted life. So please, if you have symptoms of COVID-19, remember that's a new continuous cough or a fever or a loss of or change in your sense of taste or smell. Please do not wait for a few hours or a day or two to see if you feel better. Start self-isolating immediately that you experience these symptoms and ask for a test immediately. And to remind you, you can do that by going to the NHS Inform website or by phoning NHS 24 on 0800 028 2816. That's 0800 028 2816. If we all do that when we experience symptoms, and if any of us who are contacted to say we've been in close contact with someone who has the virus and we agree to self-isolate, then all of us are going to help enable the whole country to get out of lockdown, not just a bit more quickly, but more safely as well. Final point I want to make before we move on to questions is that the best way of all of us to reduce our chance of being a close contact of somebody with the virus and being asked to self-isolate as a result is by continuing to stick to the key public health guidance. And of course, that is also our best way of avoiding getting and transmitting the virus. So just to remind everybody what that guidance is, you should still be staying at home most of the time right now, and you should still be meeting fewer people than you normally would. If your life feels like it is getting back to normal right now, please ask yourself why that is, because it shouldn't yet be feeling as if it is getting back to normal. When you do meet people from another household, you absolutely must stay outdoors. Do not go indoors, and you must stay 2 metres apart from members of the other household. Please do not meet up with more than one other household at a time. Don't meet more than one in the course of any single day. And please keep to a maximum, I stress a maximum, of 8 people in any group. Wash your hands often, make sure you're doing it thoroughly. If you're out of your home, take hand sanitizer with you. Wear a face covering if you are in an enclosed space where physical distancing may be more difficult, for example, in a shop or in public transport. Again, I want to stress that. We know that one of us wearing a face covering helps reduce the risk of us transmitting the virus to somebody else, and somebody else wearing a face covering reduces the risk of them transmitting the virus to us. It's another way in which we can all act to protect each other. Avoid touching hard surfaces, and any you do touch, make sure you're cleaning them thoroughly. And as I've already covered today, if you have symptoms of COVID-19, ask for a test immediately and please follow the advice on self-isolation. Above all else, all of us right now should remember that in every single individual decision we take, we are potentially affecting the health and the well-being of others, and indeed the well-being of the whole country. So if all of us continue to do the right thing, if all of us continue to stick to these rules, then we will continue to see the progress that I have been reporting in recent days, and we will be able to come out of lockdown, hopefully even more quickly, but much more importantly than that, we will be able to do that sustainably, because we will come out of lockdown and continue to suppress this virus, which is our overall aim. So thank you for everything you've been doing. Please keep doing it so that together we can continue to make this life-saving progress. Thank you very much for bearing with me today. I'm joined, of course, as usual, by the Chief Medical Officer and by the Health Secretary, who will help me with answering the questions, but we are now going to go straight to questions. We've got a large number of questions today. We will get through all of them. And the first one today comes from Glenn Campbell from BBC Scotland.
First Minister, from Saturday, single adult households in England will be able to form a support bubble with one other household. Are you planning to do anything like this, and if so, when? And one brief extra question to you and the Chief Medical Officer, is the 2-metre rule a fixed rule in Scotland?
On the first of your question, we are considering moving to phase 2 a week today, which is our next review date. And I think it's really important. I feel very strongly about this, that if we are to come out of lockdown at the right pace and in a way that is sustainable and doesn't risk the virus running out of control and us having to go backwards, we stick to our plan and we do things in a very methodical way, stick to our review timetables, make sure we are assessing all of the evidence and taking careful and well-founded decisions. And that's what we're going to continue to do, not come here every day and announce different moves out of lockdown at these briefings. So I'm going to stick to that very planned way of doing it. And we will be considering all of the things that are in phase 2, which of course includes greater social interaction for individuals. I want to get people able to see more of their families and friends. We've had questions here before, for example, about couples who live apart. These are particularly difficult times for people in these circumstances, for people who live alone, also very difficult. So we want to move to greater normality as quickly as possible. But we don't do anybody any favours. I will not do anybody any favours by taking these decisions in anything other than a well thought out, well planned way, or by trying to move too quickly, because then we risk having to go backwards. So we'll set out next Thursday whether and to what extent we can go into phase 2. And as I've said before, I'm optimistic on the basis of the data as it is right now, but we'll all increase the possibility and the likelihood of being able to ease more restrictions if we all stick to these rules for now. I'll hand over to Gregor in a second on 2 metres. We look at the evidence and we'll consider the evidence in all of these aspects on an ongoing basis. Right now, the evidence I have, the advice I have, is that we shouldn't change the 2-metre rule. That doesn't mean I will close my mind to it in future. I think it's really important to emphasise that this is not an absolute discussion. Just as it's not the case that there is no risk of transmission at 2 metres, there would be less risk of transmission if it was 3 metres or 4 metres, it is the case that there is greater risk of transmission at 1 metre than there is at 2 metres. So this is about relative risk. It's not about saying there is a particular distance that is absolutely safe. And it's often a trade-off. So if you go for a shorter distance, there are other things you would have to do potentially to mitigate that. Some of the countries that follow a 1 metre or a 1.5 metre rule have much, much stricter requirements in place for face coverings. And in fact, some of these countries, particularly Asian countries, have a very different culture around face coverings. There may also be a trade-off in terms of time. Right now we say that the risk is minimal if you're 2 metres away from somebody for no more than 15 minutes. If that goes to 1 metre, that time consideration may be different. And my last point, before I hand over to Gregor, is that some of the emerging evidence around how and where this virus most transmits, the kind, I was talking about this yesterday, I think, around the K number, the evidence around super spreading events or settings, clusters of this virus, could suggest that the kind of settings where reducing 2 metres may deliver practical benefits may also be the kind of settings in which the risk of transmission is greater. So that's a very long-winded way of saying this is not a straightforward calculation. There's lots of different things we've got to consider, and we've got to consider them carefully. But right now, the advice given to me is that we shouldn't change 2 metres, but we will continue to listen to advice if it changes and consider the evidence on an ongoing basis. Gregor.
So the risk that's associated with distancing is a continuum. Physical contact is probably the greatest risk. At 1 metre, you start to reduce that risk, but at 2 metres, you reduce that risk even further. And the evidence around about this has been considered as recently as last week by SAGE again. And what those experts have advised is that the degree of risk starts to increase between 1 and 2 metres by between 2 and 10 times, depending where your location is in relation to the person that you're standing beside. So at this moment in time, the absolute guidance in Scotland is that we should remain with the recommendation that people keep 2 metres, a minimum of 2 metres distance between each other. Now, that's right for this point in time in the epidemic. It's possible that we will review that in the future and come to another conclusion. But the evidence at this moment in time for the situation that we find ourselves in just now is certainly that the 2 metre guidance should remain.
Thanks, Gregor. Ross Govins from STV.
Afternoon, First Minister. Nearly 630,000 people in Scotland have been furloughed. Many must be watching the almost daily job losses seemingly across all sectors, wondering, are they next? Is there a real danger many of those in furlough will not return to their jobs?
Well, my objective is to manage our way through this pandemic in a manner that suppresses the virus and doesn't lead to a risk of a resurgent virus which will take us back the way and do even greater damage and probably, undoubtedly actually, more long-lasting damage to the economy than even what we see right now, while at the same time making sure that we can open up our economy again to get businesses operating and earning money again so that they can preserve jobs and not face the prospect of making people redundant. As I've said right throughout this, that is not an easy balance to strike, but it is the balance that we have to strike to the best of our ability. We need to make sure that as we go through that careful, inevitably and unavoidably gradual process, there is support in place for companies, and we will continue to talk to the UK government about making sure that the furlough scheme, for example, is not ended prematurely before we are in a position of enabling businesses to open up again. And some other countries have already announced much more extensive sort of arrangements in terms of job support and wage support schemes. So we will continue to have these discussions with the UK government. We will continue to look at the support arrangements that we can put in place here in Scotland. But this is about, and I think it's really, really important that while I understand that, particularly if you're an employer facing, horrendously difficult times and facing horrible decisions about those who work for you, and if you're somebody working for a firm that is facing difficulties and worrying about redundancy, I understand that it can be very easy to see this as a trade-off between what we need to do to tackle the virus and what we need to do to protect the economy. But we can't see it as a trade-off like that. We've got to get both of these things in sync, because if we act too quickly on easing lockdown and the virus runs out of control again, then that will do more damage to the economy. Equally, if we go more slowly than it is necessary, then that would do unnecessary damage to the economy. So getting all of these decisions taken at the right pace with the right interdependencies is vital. And that's why, going back to my answer to Glenn, I'm determined to do this in a methodical and planned way. We've got our 3 weekly cycles. We look at the evidence very carefully. We take balanced decisions. We're trying to give the tourism sector, for example, the ability to plan ahead. So the announcement yesterday that all being equal and all going well, we would see a reopening of the tourist sector in mid-July, from the 15th of July, gives that sector that is dependent on advanced bookings a bit more clarity and ability to plan. So we'll do that as far as possible, but we have to keep the virus under control. I can't stress that enough. If this virus runs out of control again, then we're all back to square one. More people will die and the economy will suffer more damage. So, these are the daily judgments and balances we've got to continue to strike, and we will continue to do that to the very best of our ability. Peter McMahon from ITV Border.
Thank you, First Minister. Could I just pick up on that remark you made just at the end there about tourism and the date of it getting back to some kind of normality on the 15th of July? Rachel Hamilton, the spokesperson for the Scottish Conservatives, says that this move is, and I quote, too little and too late. How do you respond to that?
I should explain that I've just choked on some water. I'm not coughing for any other reason right now. I would respond to that, I suppose, pretty straightforwardly. I don't know what Rachel Hamilton thinks we should have done. Take precipitate action to open up sectors of our economy while we still judge that that poses a risk of the virus running out of control. Not only would that be reckless and irresponsible in terms of what should be the primary duty of any government to try to preserve people's health and life, but it also wouldn't have been doing any favours to the economy or the tourist sector of the economy. So it's very easy for opposition politicians, and I've been an opposition politician, so I'm not trying to be particularly critical here. It's in the nature of it, although you hope at times like this people would rise above it. But it's very easy for politicians to say that whatever we decide to do, that it's the wrong thing or it's too little, too late. And I'm sure if we did something else, they would say that as well. These are difficult decisions. I want to get the economy going as quickly as possible. It's not in the Scottish Government's interest to see the economy closed down for a minute longer than it has to be. But I'm not prepared to take decisions that I would be taking knowing that we were putting lives unnecessarily at risk. So my job is to take the decisions, and that's a responsibility I take seriously. The opposition's job absolutely is to scrutinise that, and I have no complaints about that. But I hope everybody in a time of severe crisis like this will understand that none of these decisions are easy or straightforward. They all involve difficult judgments and difficult balances, and we are trying to get it as right as possible in the interests of human health and life, and in the interests of the economy too, and I hope we can move forward on that basis. Alan Smith from Bauer.
Thank you, First Minister. The COVID committee yesterday had some pretty worrying evidence from Inclusion Scotland about the number of disabled people who have been pushed to the brink mentally as a result of lockdown, and they say that many of them have this fear of being abandoned due to the withdrawal of some support services. So what would be your message to those disabled Scots who are feeling abandoned? And Inclusion Scotland also say that there are disabled people who are at a high risk but not in the shielding group and don't have the same access to government help as provided to those in the shielding group, and they're looking for tailored and specific advice. Is the Scottish Government looking to provide that advice to them?
Let me make a few general comments. I'm going to hand over to the Health Secretary, who may want to say something more specifically about this, but we listened very carefully to what Inclusion Scotland had to say yesterday, and I suppose there's a couple of points I want to make. The first one is I don't want anybody across Scotland to feel abandoned, and I will do everything in my power every single day to make sure that nobody is abandoned or nobody feels abandoned, and where we're failing in that at any point, we will try to redouble our efforts to address that, and that will be certainly the case as we look at and try to respond to the comments that were made yesterday. We know, I've said many times, and others have said, we're all in this together, and at a very basic level that is true. But that kind of statement masks the reality that for many people this is a much more difficult experience than it is for others because of their particular circumstances, and we should never forget that. I suspect there is not a single person in the country that doesn't find aspects of this a struggle and that doesn't find that there has been an impact on their mental health. And I mean that quite literally, not probably a single person. But we know that impact will be greater on those who came into this crisis with real challenges, and that will include people with disabilities, and we've got to recognise that in our response. And we have, as we've reported here, on many occasions, we've made funding and support available to different organisations to try to increase the ability they have to support people in particular circumstances, and we'll continue to look at how we do that. My final point would be on the shielded issue you raised. It's medical advisors, chief medical officers who give advice on who should be in the shielded category. That's not for people like me to to decide, because these are clinical decisions. But at a much earlier stage, of course, we put in place a helpline for vulnerable people who are not in the shielded category. And I don't have the number in front of me right now and don't want to try and give it from memory in case I get it wrong, but we'll put that number out on the Scottish Government Twitter account this afternoon, just to remind people that there is help for people who feel vulnerable and are vulnerable, even if they're not in the shielded category. And I want people to be very aware of that. But I'll hand over to the Health Secretary, who might want to say a word or two more.
Thanks very much. We are paying very careful attention to the evidence that Inclusion Scotland gave yesterday. We have a long track record of working very closely with Inclusion Scotland on these matters, and of them directly helping and advising us. So if there is more that they think that we should be doing, then I will pay very close attention to that. We have put in place, as the First Minister said, a range of support services. We've put in place additional funding to ensure that support packages for individuals via local authorities are not reduced, as local authorities have to scale up the work that they are doing to support other individuals requiring support shorter, longer term as a consequence of the virus. And we've put in place some additional support in terms of PPE, for example, for personal assistants and unpaid carers, because those issues were raised with us and we understood how important they were. So I am very open to discussing more with Inclusion Scotland what more they think we could usefully do, as well as making sure that the supports that are there, that people know that, and that they and the Glasgow Disability Alliance and other organisations are helped to promote the support that is there, as well as look at what additional support might be particularly needed, if any, for people's mental health and well-being. So we will continue to look at these matters, because this group of people, like other groups of people, are really important to us.
Thank you. Jack Foster from Global.
Good afternoon, First Minister. Just picking up on the issue of potential job losses again, which obviously seems particularly relevant today with these announcements from the likes of Centrica and McDonald Hotels. You've said that you're committed to protecting the economy as a whole, obviously, but what reassurance can you give to people across Scotland who are looking at these announcements and feeling like it could be the tip of the iceberg? And is there any reason why thousands of Scots shouldn't be, quite frankly, scared of what lies ahead for the economy, for their livelihoods, and in many cases, the ability to put food on the table?
Well, I mean, it's an important question. It's an important way of asking the question. So let me try and address it directly. I mean, firstly, politicians like me often talk about supporting the economy and supporting business. What we actually mean fundamentally when we talk about that is supporting people's jobs and livelihoods, because if we support the economy, we support the ability of businesses to employ people and sustain people in employment. So this is all about protecting jobs and preventing, as far as we can, the loss of jobs and the redundancy situations that we are hearing about day in and day out. And that will be an iron laser focus from this government, working of course with the UK government, who still hold many of the economic levers every single day as we move through the different phases of this crisis. And on your question about how people should feel, I'm not going to stand here and suggest to anybody that this is not a deeply worrying period that we are living through. People feel anxious about their health, and people feel very anxious about the implications for how we're dealing with a potentially deadly virus for their living standards and their livelihoods in future. And I can't stand here and take away all of that anxiety for people. What I can do, and what I've tried to do every single day of this crisis, is to make clear that we are doing everything as a government that we reasonably can, firstly to steer the country through the health crisis, but also to do everything we can to mitigate the economic crisis. And as I've said before, and I won't repeat it all, the two are inextricably linked. And that focus and that determination will continue for every day that it is required. I think inevitably, as hopefully we continue to see the immediate impact of the virus recede, more and more of what you will hear me and colleagues talking about from these platforms in the weeks ahead will be what we're doing to support the economy and jobs, and that is absolutely right and proper. But I want to assure people that this has the absolute focus and attention of me and the government, and it will continue to do so every single day that we are living through this crisis and all of the consequences of the crisis that unfortunately are likely to be with us for some time to come. And all of it, in an economic sense, is about protecting jobs and protecting economic activity, and within that, protecting the groups that we know are likely to be most seriously affected. We know from previous recessions and economic downturns that it's often younger people and people who are already quite far away from the labour market who bear the biggest burden of that, and that is very much in our sights as we try to map our way through the economic aspects of what is an incredibly difficult time for everybody. Tom Eden from PA.
Thank you, First Minister, and good afternoon. According to the government's figures published last night, there have been just over 18,000 care home workers in Scotland tested for the coronavirus so far, which leaves about 35,000 yet to be tested. Sir Donald McCaskill said yesterday that your plan for routine testing was still some way off, and the actual number of tests seem to be stagnating, and there's a huge gulf between actual tests and testing capacity. I was wondering, given the tragic situation the sector's experienced, are you concerned that there's not enough urgency in getting care home staff tested?
I'll hand over to the Health Secretary, but I think she and I have made very clear we want to see progress accelerate, which is why the Health Secretary has been very clear and very direct with health boards. And part of the reason we're publishing data, the initial data was published yesterday, it will now be published weekly, is so that people can see the progress that is being made. But as I've also made clear, this is not a one-off exercise. This is something that is going to be done regularly and routinely, and therefore it is important, even if it, to the frustration of all of us sometimes, takes a bit longer to get operational. It's important that it is operationalised in a very robust way, because we need it to be sustainable, and that's what health boards are putting in place. Of course, the figures that you refer to are actually higher than we thought yesterday, because there was a figure that was wrongly reported yesterday, but there is still a way to go. But we will also be, in all likelihood, moving to routinely test other groups of the population as well, healthcare workers in addition to social care workers, and we'll take decisions on that shortly. I would simply caution a little bit about looking at overall testing figures, which is perfectly legitimate to do, but as you do that, to understand that underneath those headline figures, there will be a bit of change, because which will hopefully continue to be the case, the prevalence of the virus reduces. We hope there will be fewer people coming forward for testing because they have symptoms, because there will be fewer people, we hope, with symptoms, but we want to see the strands of testing that are about routine, regular testing of people, whether they have symptoms or not, increase. So there'll be, underneath those headlines, changes in the different strands of our testing approach. I'll hand over to Jeane, particularly on care homes.
Thanks very much, First Minister. And just to follow on from the point that you ended on, as we see the additional measures that we've introduced for care homes, including that additional clinical support in terms of staffing, the use of PPE, infection prevention and control, then I would expect to see the number of residents tested on a week-by-week basis reduce, because that would be one of the additional indicators that the level of infection in care homes was itself reducing. The number of staff tests, of course, should continue because it is that iterative process. And as the First Minister said, I have made very clear to our health boards, who are responsible for this and directly accountable to me for it, that I will see from them every week their weekly plans about what they have done in the previous week in terms of testing of the care home workers and care home residents where it's appropriate to test the residents in all the care homes in their board area, and what they plan to do for the following week. And that is the data that, with increasing validation and improvement, we will be publishing on a weekly basis in order to ensure that the policy, which has been clear, is delivered. And we now have some additional resource. We have the UK Social Care Portal, which provides some level of test kits. That has now increased in its number, which assists the speed with which this work can be done. But of course, boards will supplement that with their own testing capacity, bearing in mind that the majority of, in fact, all of our mainland boards now have direct testing capacity, including the processing of those tests, and we have satellite arrangements for our island boards. So we take this very seriously indeed. It is important, particularly for care home workers, that they have the assurance of whether or not they are positive for the virus, in which case they will be isolating at home, and where they have problems in terms of their terms and conditions, of course, we have stepped in to alleviate those problems, but also to know that as they go into a care home, they have a negative test, and therefore they can continue to provide the significant quality of care for residents that they do provide. As we see this making continued progress, then we will look at what more we can do to assist residents and care homes in how residents are looked after.
Michael Blackley from the Daily Mail.
Hello, good afternoon. Just to continue on the same issue, I mean, some in the care home sector are petrified at the prospect of a second wave of this virus, and they really feel that you aren't learning from mistakes that have already been made, particularly on the issue of testing. It seems from today and recent days that you're very much blaming health boards for failing to deliver on the promise that you've made on testing. But a lot of these health boards are under special measures. They're subject to Scottish Government scrutiny. Why is it that they are failing to deliver on your promise? And how long is it going to take before we get to the stage where there's weekly testing of all care home staff?
Well, let me be very clear, which I think I've been repeatedly. I'm not blaming anybody. I think people who've watched these updates on a daily basis, any reasonable-minded person will conclude I've never stood here and blamed anybody. Ultimately, as First Minister, I'm responsible for a response to this virus, but it is a statement of fact that in practice it is health boards who have to deliver the testing programme. So we work with health boards, we make sure they've got the resources, and if there are issues with the resources, they know they can come to us and we resolve that. But we need to have these partnerships working effectively, and as I've said before, not to blame them, but as a statement of fact, care home providers are an important partner in the work we're doing to protect care home residents as well. I think the final point I would make there is just what has occurred in care homes, not just in Scotland, but in many, many countries across the globe in the course of this pandemic, has been undoubtedly the most upsetting aspect of a very upsetting crisis that we've all lived through, and that is the case for all of us, but for nobody more so than those in care homes, those working in care homes, and of course the relatives of those who have died in care homes. So I'm not seeking in any way to take away from that reality. But we have a situation in care homes now where we see the number of care homes that have an outbreak of COVID-19 declining. We see the number of people dying in care homes declining now, thankfully, very rapidly. So what that says is not that there's no more work to be done, but what that says is that the package of measures, of which testing is only one of those measures that we have been putting in place, is having the effect that we want these measures to have. And for those who understandably are worried, we are all concerned about the prospect of a second wave of this virus, that we should take some assurance for the fact that these measures that we are putting in place are driving down the virus in care homes right now, and we will continue to make sure not only that we implement the measures we expect to be implemented right now, but continue to listen to advice and evidence about further steps that we are able to take. Chris Musson from The Sun.
Good afternoon, First Minister. Just going back to Glenn Campbell's question on Boris Johnson's support bubbles for couples. In answer, you said that you'd stick to our plan and mentioned the plan move to phase 2 next week. But in your route map, the relevant phase 2 measure says meeting people from another household indoors with physical distancing and hygiene measures. And indeed, that physical distancing indoors element remains in phase 3 too. So can we rule out couples getting back together until phase 4, or are you considering separate guidance still, as you've previously suggested?
Well, as you will recall when we set out the route map, a route map is the indicative phasing and the steps we will seek to take within each phase. It can't cover every eventuality, and I was very clear when we set out the route map that there's a lot of detail that lies underneath that we have to consider as we go. So we are considering all sorts of different points of detail that lie under the broad kind of categories we set out in the route map, and that will involve, I've talked about construction today, so we have a phasing in our route map for construction, but the construction industry itself has its own restart plan that within our phasing is being operationalised. So there will be more detailed bits of guidance that lie underneath the headlines of the route map. That's what makes some of these decisions so very intricate and complex, and we are considering all of the different things we've got to balance here. I was very clear as we went into phase one that we couldn't, and remember the context here, we've got, even now when we see the data going so firmly in the right direction, we still have limited headroom to change things before we risk the R number rising and the virus going out of control again. In phase one, I was very clear we shouldn't spend, for want of a better word, all of that headroom just on however important it is getting the economy going. We had to recognise people's need for social interaction and family and friends contact as well. And getting that balance right will continue to be important. So I'm not going to stand here a week out from the review and randomly announce things that might or might not happen. But we will take a very considered approach to whether we go into phase two and what going into phase two means. And there will be some things that we might not be able to do at the immediate point of phase two. There may be a phasing within phase two. There may be some things that require greater guidance. But getting all of those decisions right and recognising the reality of how people are living their lives right now and trying to come to a view on what will make the biggest difference to people's quality of life. And that will be a balance of getting the economy back together to try to mitigate some of the fears people have about job losses, but also enabling people to come into contact with each other a bit more and get that quality of personal life back as well. So we'll continue to do that in a considered way and reach judgments that then I'll stand here. Well, I won't stand here, I'll be in Parliament next Thursday setting out the conclusions we've reached and the rationale for them. Simon Johnson from The Telegraph.
So Tom Hunter yesterday called for the 2-metre rule to be reviewed straight away. He warned that if it's kept in place, that the furlough scheme could end up being a bridge to mass unemployment. Both he and Andrew Wilson have warned that mass unemployment could end up causing more deaths than COVID via poverty. And Mr. Wilson on the television last night said that if other countries are moving towards a lower limit, we will have to move towards it because many businesses, tourism businesses, hospitality are telling us at 2 metres they will fail. It just won't work and jobs will be lost. I just wanted to get your reaction to those comments and whether you think that the 2-metre rule is sustainable.
I don't know if you were on the call earlier on, but I gave a very lengthy answer and then Gregor gave a lengthy answer to Glenn Campbell. So I'm going to try not to repeat everything I've already said. But and this is not a comment directed at Tom or Andrew or any individual, I know why people are making this argument because everybody desperately wants to see businesses operational in as conducive a way as possible to get back to normal. But I really think people have to stop seeing this 2 metre versus 1 metre as almost some totem or ideological position. As I said earlier on, these are difficult judgments and there are no absolutes in this. So we know that the risk of transmission at 2 metres is less than it is at 1 metre. The risk of transmission at 3 or 4 metres would be less than it is at 2 metres. So you have to come to a judgment and you have to understand the trade-offs. So if you go from 2 metres to 1 metre in a crowded place, then part of the trade-off would be you would have to wear a face covering or you could spend less time within that distance. So we have to come to consider judgments about this. And remember, coming back to the basic point here, I want to get the economy going as quickly as possible, and I want to get it going in a way that is as close to normal as possible, as quickly as possible. But if the consequence of doing that is that this virus spreads again and more people start dying and we have to lock down again, that is not helping the businesses that are arguing for a change to this. So we have to consider the evidence carefully. The advice that's been given to me right now is that we shouldn't change the 2 metres, and if I was to act against that advice, I'd no doubt have the Daily Telegraph and others asking me why I thought I knew better than the experts who were giving me the advice. But we have to take, as our very first paper set out, we have to balance all of the different harms here, and we will keep trying to come to the right judgments, and we will keep reviewing the decisions we are making so that we are taking account of the best evidence at the different stages of dealing with this epidemic. Sev Carell from The Guardian.
Yeah, good afternoon, First Minister. Can I just go back to the responses you gave to Glenn Campbell and to Chris Musson? I believe that you were the first UK government leader to use the word social bubble when you spoke about the Belgian bubble on the 24th of April, but you now seem to be stepping away from that quite carefully. You haven't used the concept of a bubble for quite some time. Are you now hinting to us that when you announce next Thursday the next phase of easing the lockdown, that the concept of a bubble where two families or two households can be much closer together has now been dropped from your planning for the time being?
No. And can I just say, I'm not going to proceed through this pandemic by hinting at things. When I've got something to say, I'm going to say it. I've not taken the approach during this that politicians would take during normal times or an election campaign of briefing the newspapers in advance or of giving you a nod and a wink. I've stood here at this platform and announced decisions, and that's what I'm going to continue to do. So you can't read anything one way or the other into what I'm saying today, because we're still in the process of reviewing the evidence. We did talk about a bubble before. As we went into phase one, the advice was it was better to do what we have done, allow people to meet one other household outdoors and not limit it to just one household, but to emphasise the outdoors and the overall numbers. As we go forward, we will look at the evidence, and if we can do that in a way that allows people to meet people differently, we will do that. So I'm not hinting anything, I'm not giving you a nod and a wink about anything, I'm just doing the really old-fashioned, traditional, or perhaps not traditional thing of a politician saying I'm just going to take the methodical, systemic, careful, weighing up all the evidence and trying to come to the best decisions I can through this. So don't treat this as if it's a kind of normal nods, winks, briefings in advance. I'm just trying to be as open and frank with people as I can be, and we haven't come to these decisions yet. Kieran Andrews from The Times.
Thank you very much, First Minister. On the resumption of construction work, does that mean that there are any paused government infrastructure projects that can now be resumed as a result of this change?
That may very well be the case, but I don't have a list of these projects in front of me, so we can give you some detail on that later on, if that would be helpful. Tom Martin from The Express.
Hi, good afternoon, First Minister. Could I just briefly follow up on these questions on the social bubble? What comfort can you give to the likes of grandparents wanting to hug their grandkids again, or lovers living separately who might be looking rather enviously on at the bubble proposals south of the border after 12 weeks of lack of physical contact? Is there any comfort at all you can give to people?
I'm not just going to start repeating myself for the sake of repeating myself. I've answered this fairly extensively now, and so the comfort I will give is that a week today I will stand in Parliament and outline the conclusions we've reached about going into phase two, whether we think we can do that, and if we can, to what extent, and what that means in terms of lifting further lockdown measures. I'm very hopeful we will be able to take some significant steps forward next week. But the other comfort I will give, and I don't expect people to, be delighted about any of this, because I totally understand the frustrations people are living with. But what I'm trying to do is make changes and take decisions in a way that gives people as much of their lives back as quickly as possible, but protects us from this virus. And we can't take our eye off that ball. So that's why I'm trying to do things really carefully. Believe me, the easiest thing in the world would be for me to stand here day in and day out, or once a week, if I was only doing this once a week, and say, because I'm standing here, I need to announce something that I'm going to do for lifting lockdown. But it wouldn't be sensible, because, a few weeks from now or a couple of weeks from now, I might have to say, do you know what, that wasn't the most sensible thing to do because I hadn't thought it through properly, so I'm going to have to go back the way. So call me boring if you want, but I'm going to stick to the plan here to try to get Scotland through this as safely and as sustainably as possible. And if sometimes that means doing things a little bit slower than people understandably want, then please at least know it's for a good reason. I've said all along, this is not a popularity contest. My fundamental duty as First Minister right now is, to the best of my ability, is to steer this country as safely as I can through the biggest crisis any of us have ever lived through. And that's what I'm going to continue to focus on every day. Tom Peterkin from the P&J.
Good afternoon, First Minister. It's already been mentioned, but it's been reported this morning that all 2,299 people in McDonald hotels are being consulted on redundancies. This potentially could have a huge impact on the north of Scotland. There's still a number of weeks before the tourism industry restarts. Can I ask you what can you do now? And yesterday, Fergus Ewing suggested that there might be support for the Highland Wildlife Park, which is said to be heading towards extinction, in inverted commas. Are you able to give us any more details on that?
I'm not able to give any more details on that right now, but as Fergus said yesterday, that, as well as many other things, are under consideration. But the fundamental point I need to make here, the reason we gave an indicative start date for tourism yesterday was to allow businesses in the tourism sector to start to plan and to take bookings and to start to see light at the end of the tunnel. And hopefully, that, whether it's McDonald's hotels or any other hotel chain or business in the tourist sector that are suffering such severe challenges right now, that will be helpful, not in getting them back to normal straight away, but in giving them a planning horizon that they can start to look towards. So I very much hope, and we are absolutely focused on trying to get through this in a way and at a pace that mitigates the kind of job losses that we are hearing being consulted about right now. But I come back to my central point here. We have to do this safely. We have to do it in the right way and at the right pace, because if we take a misstep on this, we send everybody back the way, and that would be disastrous. So we will continue to do this as and when we can. We will speed it up, and I desperately want to speed this up as much as possible, but not to the extent that we risk it all going backwards. And these decisions are not going to get any easier, but they become more vital to get right with every day that passes. Vivian Aitken from The Record.
Sorry about that, First Minister. Good afternoon. I'd like to ask you about childcare provision for key workers and ask why it varies so much from council to council. An example I'll give you, a mum and dad, both nurses, live in South Lanarkshire, where provision is just 9 to 3, which is far short of their need as they work 12-hour hospital shifts. Before COVID, they would rely on breakfast clubs, after-school clubs, help from family and friends, but none of this is currently open to them. Mum works in ICU, dad in HDU, so they're frontline workers. Friends of theirs who are single parents have been forced to breach the guidelines to ask grandparents to help out, as they actually have no other option. But a neighbouring council offers 8 to 8 cover, and some large city councils are providing 8 to 6 cover. So why has there been allowed to be such a variation when our healthcare workers need our practical support more than ever? And will the Scottish Government step in to alleviate matters to help during the school summer holidays?
Well, we work very closely with local authorities, but in short answer to your central question there, why is this local authority determined? It's because education childcare is the statutory responsibility of local authorities, and they make these decisions based on their local circumstances and needs. But we have been working closely with them to make sure there is the childcare that children of key workers but also vulnerable children need. We have had a hub provision right throughout this crisis. Part of the phase 1 changes is to increase the availability of critical childcare, and we've also indicated that will run through the summer. And the Deputy First Minister chairs the Education Recovery Group, which is looking at all of these issues on an ongoing basis. We're also currently looking at things like free school meal provision over the summer, because we recognise there will be a need for support like that. So these are local government responsibilities. In normal times, usually I'm getting criticised for us not allowing local decision making of local councils, but in a time like this, it's important that we seek to coordinate that as much as possible, and that's what we have been doing. Derek Healy from the Courier.
Thank you, First Minister. The Courier reported today that 70,000 COVID-19 test results from UK-run regional test centres in Scotland still have not been published. The UK government says it's been sending this information to Holyrood for weeks, and almost a month ago you said the results would be available within a matter of days. Are you able to say, please, why this information still hasn't been published, and can you give a specific date for when it will be?
Well, the information has been published. So it's actually 72,408 tests as of today have gone through the UK-wide systems, the drive-through centres. That information has been published on a daily basis. What has not yet been possible is to break it down into positive and negative in the way we do with the results coming through our own NHS lab framework, and that's because we haven't until recently had the data of a quality and in a form that we can do that. We are now very close. I would hope in literally a day or two to be able to publish that daily alongside the information we currently publish about test results coming through NHS labs. But the number of tests are published on a daily basis. I should also say the information is published, so the Scottish number will be published as part of the UK number every day, and that is broken down into positive and negative, but it's not disaggregated for Scotland. So the information is published. It's also now going through Test and Protect. So all of this information is there, but that positive, negative, I would hope, possibly, I can't give an absolute guarantee on this yet because we're still doing final quality checks on this, but I would hope even as early as tomorrow we can start to publish that breakdown. But just to be clear, the numbers have been published and have been published for some time. Terry Murden from the Daily Business Group.
Good afternoon, First Minister. Can I just follow up on the proposed date for reopening the tourism sector? Could you clarify the position with retail, particularly as many tourism businesses are retailers or include retail in their operations, such as gift shops? Are you making a distinction here, and how will you do that? For instance, would you define a small art gallery or a craft workshop as a tourism business, but not a high street stationer or greetings card shop selling the same sort of items?
Well, as we go forward, Ferguson covered some of this. Obviously, there will be guidance and sort of safety guidance as well as broader guidance for the sector. But retail in the route map, retail is. Although in all of these things, it goes back to a point I made earlier, the route map is a very high-level document and we distinguish between retail and tourism, but of course there are overlaps there. I hope to say more about retail when we give the update next Thursday, but we haven't taken those decisions yet, so I will not say more about it right now, but we'll say more about that as we decide the Phase 2 decision next week. Muir Dickey from the Financial Times.
Thank you. Professor Neil Ferguson said that if the UK had started lockdown a week earlier, less than half as many people would have died. What, if anything, have you taken from experience of being part of that decision that changes the way you look at how we come out of lockdown? And a quick one for Dr. Smith, if I might. The data today shows that our estimate for the R number in Scotland is substantially over 0.5, but we're expecting the number of infectious cases to fall by more than half in the 2 weeks to June 19th. Could you give a kind of layman's explanation of how those two things can be true? Thank you.
I'll definitely hand over to the Chief Medical Officer on that second part of your question. On the first part of the question, I mean, I listened to Professor Ferguson yesterday, and I think, to be fair to him, he was not. He was being pretty candid that he was seeking to apply hindsight. This was not something that had been advised at the time. I mean, I think it is undoubtedly the case that when we come to look back on the things that were done and not done, then because, firstly, there will have been mistakes made. straightforward mistakes, and I think it's really important to be candid about that. We haven't yet done the look back in a sort of detailed enough way for me to stand here right now and tell you what all those mistakes were and why they were made, but I think in the fullness of time that's really important. But there will also be things that, had we known then what we know now, we might have done differently, but you don't have the hindsight when you make the decisions. But again, for learning for the future, that will be really important. One of the things, and I've talked about this here before, but also, you know, it's obvious in all of our decision making right now. One of the things at a reasonably early stage we took the decision to do was to establish the Chief Medical Officer's Advisory Group so that we had an additional source of scientific advice that was very much hooked into SAGE, but was direct to the Scottish Government with the ability to translate the SAGE advice into particular Scottish circumstances. And in terms of, I suppose, my ability now coming out of lockdown to make sure that our decisions are very tailored for Scotland, then that was an important development to give us the underpinning advice that we need in order to do that with confidence. Gregor.
Yeah, I mean, it's a really good question, actually, and whilst I don't pretend to understand all the intricacies of what's a very complex mathematical model that predicts both the R number itself, but also starts to model the kind of cases that lie ahead. One of the things that we've got to factor into that is actually what has previously been termed the kind of doubling time for the virus, and how that has gradually stretched out over time. And I think perhaps the best way that I could try to get you an accurate answer to that is to ask the chief statistician to be in touch with you to kind of explain exactly why we're seeing this pattern in the data that you've described.
So I pass it on to the Chief Medical Officer, who has expertly passed it on, rightly I should say, to the Chief Statistician, but we will give you a technical answer to that question as soon as possible. And lastly today, Tom Gordon from the Herald.
Hello, First Minister. Hi there. Can I just take you back to the data on the testing of care home staff that came out yesterday? Now, you told Parliament it was about 15,000 in total. That was later revised up to about 18,000. It later emerged that data includes 4 weeks of material from before the policy even being announced. It dates back to April 20th, but the policy was only announced on May 18th. Why was that data bulked out with 4 weeks of historic data before the policy existed, except for presentational reasons? And now that it's running at about 2,500 tests per week, and it should be over 50,000, why should people have any faith that this policy will be delivered, given the numbers are so low?
Actually, we also give the most recent week of data, but in terms of, we gave a cumulative total of the numbers of residents and staff who had been tested, because if your interest here is in how many have been tested, then surely that is the relevant number, how many staff and residents have been tested. And actually, I gave an underestimate in Parliament yesterday. You know, I think if I'd given an overestimate, the criticism might be a bit more valid, but I actually underestimated how many tests had been done because there was an administrative error in the figure from Greater Glasgow and Clyde, which was corrected last night. So there actually were more tests have been done than I reported in Parliament. So we will publish this data every week, so you will be able to assess the changes in it week on week, and that is what will be used for myself and the Health Secretary to scrutinise the progress that is being made, but it will also allow both the media and the wider public who can go on and look at this data to see the progress that is being made. So there's complete transparency around this information, as I think people have a right to expect. Jeane, do you want to add anything?
No, I think that covers it, First Minister. The weekly data is the data that we will be scrutinising, as others will, to ensure that the policy is being implemented, particularly with respect to care home workers, where we've said that all care home workers will be tested, and those who are returning negative tests will be tested again in that 7-day period. And as I said earlier, I expect to see and hope to see the number of residents tested week on week coming down, because the measures that have been introduced and the work of care home staff begins to bear fruit in preventing the virus from catching hold in a care home and transmitting from one resident to another. So that weekly data will be important. The cumulative data does show all of the testing that has been done in care homes for both staff and residents, obviously shows that that was being undertaken in advance of the policy that was announced, and that is a positive step.
And again, without in any way, shape or form minimising the tragedy that has unfolded in care homes, not just in Scotland, but in many countries, the actions that have been taken are reducing transmission in care homes and thankfully reducing the number of people who are losing their lives. So in care homes, as in the country overall, the collective actions that we are taking has got this virus in retreat. But to keep it in retreat and to keep it reducing and to keep the impact of it reducing, we all need to keep doing these things. That means government working with health boards and care home providers need to keep doing the right things in care homes, but it means all of us as citizens need to keep doing the right things to make sure that we continue with the suppression of the virus. So can I thank you for joining us today. Thank you to the journalists for joining us. My thanks to Gregor and Jeane and to Robert, our BSL interpreter today. Please keep sticking to the guidelines so that we keep making the progress that we've been able to report today. I'll be back here with you tomorrow at 12:30, but in the meantime, thanks for joining us.